Are they just getting old? Or is it something deeper? Can I ask you something personal? Have you ever watched someone you love slowly change? They start misplacing their keys, then forget how to use the microwave. Then one day, they don't remember what year it is. And you wonder, is this just aging or is something deeper happening? As a brain doctor with over 30 years of experience, I've seen this moment again and again. Families holding their breath, too afraid to say the word dementia. But here's the truth: catching the signs early can make all the difference. According to the Alzheimer's Association, more than 6.9 million Americans over age 65 are living with dementia as of 2024. That's nearly 1 in 9 older adults. But here's what most families don't realize: dementia is not just forgetfulness, and it's definitely not a normal part of aging. It's a medical condition, one that deserves clarity, not shame. Today, I want to help you see what doctors look for, the real signs, the patterns that matter, and the steps that can help you support someone you love. Comment 1: if someone in your life has ever shown signs that worried you. Or 0 if you've never seen it but want to be ready. Let's start this journey together. It's not one disease, it's a warning system. Let's clear up one of the biggest misunderstandings I see in families. Dementia is not a single disease, it's a syndrome, a group of symptoms caused by damage to the brain. Think of it like a check engine light in a car. The light tells you something is wrong, but it doesn't tell you exactly what's causing it. In the same way, dementia tells us that something deeper is affecting the brain. Sometimes it's Alzheimer's disease. Sometimes it's vascular dementia damage from small strokes or blood flow problems. Sometimes it's Lewy body dementia, where abnormal proteins interfere with brain signals. And sometimes it's a mix of several things. Each cause is different. But the early signs, they often look the same: memory loss, difficulty making decisions, mood swings, getting lost in familiar places. And here's the twist: not all dementia is permanent. Yes, you heard that right. Certain conditions can mimic dementia but are reversible, like vitamin B12 deficiency, thyroid problems, or even medication side effects. That's why getting a proper diagnosis is so important, because when families hear the word dementia, they often feel helpless. But what they're really facing is a message, a warning from the brain that says, please slow down. Something's not right. And the sooner we listen to that message, the more we can help. In my years as a doctor, I've seen patients who were told it was just old age, when in fact, they were dealing with treatable depression or infection. That's why I always say, don't assume. Investigate. Dementia is not a life sentence. It's a signal. And signals are meant to guide us, not scare us. Comment signal if this changed how you think about dementia. Your insight could help another family feel less afraid. The day everything changed. A story from my clinic. Her name was Dolores, 82 years old, retired school teacher, lived alone in the same White House for over 40 years. She came into my clinic because, as her daughter put it, Mom keeps forgetting to turn off the stove. Dolores sat quietly while her daughter talked. I asked her, "Do you remember what day it is?" She smiled politely and said, "Of course it's Tuesday." It was Friday. Her daughter laughed nervously. She always gets the days mixed up. But then I asked, "What's your address?" And Dolores paused. She looked at her daughter, then back at me, then whispered, I know it. I just can't find it right now. That moment was the day everything changed. Not because Dolores was broken, but because we finally stopped ignoring the signs. You see, for the past year, Dolores had been leaving notes to herself all over the house. Take your pills, turn off the oven, don't forget the mail. Her family thought it was sweet, organized. They called her careful, but those notes weren't organized. They were compensated. Her brain was finding ways to work around what it could no longer do easily. And the saddest part, everyone thought it was just getting old. They missed the pattern, the warning signs, until the stove almost caught fire. That's when they came in. We ran tests. Her cognitive score had dropped. MRI showed signs of early Alzheimer's. But here's the part I want you to remember, because they came in early. Because they listened to the signals. Dolores got treatment. She got support. She got time. We helped stabilize her routines, started medications to slow progression, connected her with memory coaching and safe living options, and most importantly, her daughter finally stopped calling it just aging and started calling it a condition. That's when everything changed. Have you ever seen someone using little tricks to get through the day notes, alarms, reminders, comment tricks if you've noticed this in someone you love? Why memory tests matter and what they don't show. Let's talk about something I get asked almost every week. Isn't there a test for this? Yes, there are memory tests. And they're helpful, but not perfect. Let me explain why. When someone comes to my office and we suspect dementia, we often begin with screening tools like the Mini Mental State Examination MMSE or the Montreal Cognitive Assessment MOCA. These tests give us a snapshot of how the brain is functioning today. They test things like short-term memory, attention, language, orientation like knowing the date or where you are. For example, I might ask, repeat these 3 words: apple, table, penny. Then we talked for a few minutes, and I'll say, now, can you tell me those 3 words again? Seems simple, but it tells me a lot about how the brain processes, stores, and retrieves information. But here's what these tests don't show. They don't measure emotions, and they don't capture how a person behaves at home. They don't tell me how much support that person needs to get through the day. I've had patients score perfectly on the test, then get lost walking to their mailbox. And I've had others score poorly because they were anxious, tired, or simply having a bad day. That's why I never make a diagnosis based on one test alone. These tools are part of a bigger picture. Think of them like a thermometer. A high number tells you something is off, but it doesn't tell you why there's a fever. In the same way, a low test score tells us the brain is struggling, but we still have to look deeper at the medications, the sleep patterns, the stress levels, and the family history. If you're caring for someone who's being tested, here's my advice. Be present. Tell the doctor what you're seeing at home. And remember, this isn't about passing or failing. It's about understanding. Comment test it if you or a loved one has ever done one of these memory tests. Your story might help someone feel less nervous. Hidden clues in daily life. What families often miss. Let me ask you something gentle but important. Have you ever noticed your loved one doing small, odd things and brushed it off, like putting salt in the coffee instead of sugar, or wearing 2 watches, or asking the same question twice in one conversation? It's easy to laugh, to say, they're just being silly. But sometimes, those little things aren't silly at all. They're signals. In my practice, the signs of dementia rarely arrive like thunder. They whisper first. Here are some of the most commonly missed clues I've seen over the years. repeating themselves, not just stories from the past, but questions they asked 5 minutes ago. Losing track of bills, forgetting to pay, or paying the same one twice. Getting disoriented at familiar places, like the grocery store or church. Neglecting hygiene, skipping showers, wearing the same clothes for days. Hiding mistakes, covering up burned food, or blaming others for missing items. Unexplained mood shifts, going from calm to angry without reason. Changes in sleep, waking up at 3 a.m., thinking it's breakfast time. Any one of these by itself doesn't confirm dementia. But when they start adding up, that's when I encourage families to take note. Why? Because when caught early, we can help slow the progression. We can reduce fear. We can build a care plan before things spiral. I've had patients live independently for years longer just because their family spotted these quiet signs and acted with love, not denial. If someone you love is doing something that just feels off, don't ignore your gut. Start writing things down, even small things, because memory loss doesn't always start with forgetting names. Sometimes it starts with forgetting who paid the water bill. Comment notice if you've ever picked up on one of these subtle changes. Your voice might help someone else open their eyes. Reversible or not. The things you must rule out. Not all memory loss means dementia. Let me say that again. Not all memory loss means dementia. One of the most hopeful conversations I've ever had with a family started like this. She's forgetting everything. We think it's Alzheimer's, but after a full workup, we found out it wasn't dementia at all. It was a vitamin B12 deficiency, which we corrected with injections, and her clarity came back. Not overnight, but steadily. You see, there are several treatable conditions that can look exactly like dementia. Let me walk you through a few of the most common ones. 1. Medication side effects. Many medications, especially in older adults, can cause confusion or foggy thinking. Sleep aids, anticholinergics, some blood pressure meds, and even allergy pills. Sometimes the cure is as simple as changing the prescription. 2. Infections. In older adults, urinary tract infections. UTIs and pneumonia can cause delirium, sudden confusion, agitation, or even hallucinations. And often there's no fever. This is especially true for elders who already have mild memory issues. A simple infection can push them over the edge temporarily. 3. Depression, also known as pseudodementia. Depression in older adults can mimic memory loss. They may appear forgetful, but really, their brain is weighed down by sadness, fatigue, and disconnection. With therapy and proper medication, I've seen people regain sharpness and energy. 4. Thyroid or hormonal imbalance. A sluggish thyroid hypothyroidism can lead to confusion, low mood, and poor concentration. Simple blood tests can catch it, and treatment can reverse symptoms. 5. Vision or hearing loss. When the brain gets less input from eyes and ears, it struggles to process the world accurately. This can lead to misinterpretation and even paranoia. That's why I always say, before we call it dementia, we have to look deeper. Run the blood work. Check the ears, the eyes, the kidneys. Review every medication. Because the difference between permanent and temporary memory loss is sometimes just one appointment. Comment hope if this section gave you a new perspective on what might be reversible. Let's share that hope with more families. What to say to the doctor. Questions that save time. The day you bring a loved one to the doctor for memory concerns can feel heavy, like carrying something you don't quite know how to name. You sit in the waiting room. Your heart beats a little faster. Oh, You wonder, should I say something? Should I wait until the doctor asks? Let me reassure you, you are not interrupting. You are participating. You are your loved one's voice when confusion has quieted theirs. And as a doctor who sat with thousands of families in this very situation, let me gently guide you through what to say, what to bring, and what to expect. First, what to bring to the appointment. A complete medication list. Include all prescriptions, over-the-counter pills, vitamins, and supplements, even the natural ones. You'd be surprised how often memory issues are connected to pills that seem harmless. A written list of concerns. Write down specific examples you've noticed. She left the stove on twice in the last month. He keeps forgetting his grandson's name. She got lost driving to the grocery store. A copy of past labs or imaging, if available. If your loved one has seen another doctor, bring those records. They help us avoid duplication and spot patterns. Second, what to say in the exam room. You don't need to be perfect. Just be honest. Doctors rely on family input more than you may realize because your loved one may smile, say I'm fine, even when they're struggling. So speak up gently and say things like I've noticed changes in her thinking over the last 6 months. He repeats questions, sometimes 5 or 6 times in an hour. She used to cook all the time. Now she can't remember how to boil water. Avoid vague phrases like she's not herself lately. Instead, give concrete, recent examples. Third, key questions to ask the doctor. Asking the right questions helps you get the right care. Here are a few powerful ones. Could any of these symptoms be caused by medications or something reversible? Do we need blood tests or brain scans to rule out other causes? What kind of memory test are we doing today? And what does it actually measure? At what point should we consider a neurologist or memory specialist? And one of my favorites, simple but profound. If this were your parents, what would you do next? That one always brings clarity. Watch for after the visit. The appointment doesn't end in the doctor's office. Pay attention to how your loved one responds to the memory test. Are they upset, confused, relieved? What changes after the appointment? Do they deny the conversation happened? Do they seem more anxious or withdrawn? Sometimes, how they react gives us just as much information as the test itself. Take notes. Keep a journal. You're building a timeline that helps guide future care. I know it's hard. You may feel like you're betraying your loved one by speaking up, but you're not. You're showing love in the most courageous way. By facing reality with kindness. Remember, you are not here to label them. You're here to understand them and to help their doctors understand too. Comment, advocate if you've ever spoken up at an appointment for someone you love. Your courage can give another caregiver the strength to do the same. A diagnosis is not the end. It's the beginning. You made it here. That tells me one thing: you care. Whether you're worried about your mom, your spouse, or even yourself. You showed up, you listened, and that matters. Because dementia isn't just about memory. It's about dignity. It's about safety. It's about love that stays strong even when words start to fade. And most of all, it's about action. You've learned how dementia is diagnosed, that it's not one disease, but a syndrome, that it can be confused with other treatable conditions, that memory tests matter, but daily life tells the full story, that the earlier you act, the better you can support someone you love. And maybe most important, you've learned that Asking for help isn't giving up, it's showing up. It means saying, my loved one deserves clarity, but my family deserves guidance, and I deserve to understand. So let me say this. A diagnosis is not a full stop. It's a comma, a pause before the next chapter. It's the beginning of doing things differently, of building routines that protect, of learning how the brain really works, and how it can still heal in small, meaningful ways. If this video helped bring you peace, insight, or strength, please comment with you below. Because we're all in this together, and no one should face this road alone. And if you're ready to go one level deeper, I want to invite you to our next video. As a brain doctor, cerebral small vessel disease. What to know and what to do. It's one of the most overlooked brain problems in older adults and one of the most common causes behind silent strokes, gait problems, and confusion. The earlier we catch it, the more we can protect the brain before it needs saving. I'll meet you there.